Let me just, I'm going to ask one question for all of you here, so you can probably jump in on this, Ms. Steinberg. The big conversation over the Christmas and the New Year's holiday back home was what we're seeing with constituents in our bigger population centers, so out of the rural areas, but in Anchorage and in Fairbanks, they're being denied prescriptions where the prescription drug is opioid-based. It's this, some of it goes to the bias issue, but it's the pharmacists that are refusing to fill the prescription. The doctor has prescribed, and we're not, certainly the involvement that we've had with these constituents, it certainly doesn't appear to be abuse situation, but people who have legitimately been prescribed these pain medications for these debilitating and long-term pain management issues. And I understand that it relates to the recent guidance coming out of CDC recommending restricting how much a pharmacy can do. The guidance isn't controlling law, but in an abundance of caution, the pharmacists are saying, no, we're not going to do this. So you now have the patient in the middle of a regulatory debate, if you will, and it has caused the lid to be blown off the discussions in my state, and I can't imagine it's just in Alaska. What are we doing to address this tension now, this conflict between prescriber and the pharmacist, and then ultimately we want to be helping the patient, but we've got a struggle going on, and I don't know who is addressing that. Can any one of you speak to that?
You know, there is a terrible climate of fear out there among all practitioners right now. And they don't even want to treat people with pain anymore. That's how it's gotten that bad. And I had, just like your example, I had a doctor from Dana-Farber Cancer Center call me saying pharmacists won't fill my prescription for patients that I have that they're really bad cancer. And so it's gotten to a point where it's just gotten so unreasonable. There's a hysteria out there.
So what do we do?
I think we need to educate everyone better about this issue. I think we need public education about pain and the fact that pain is a disease itself, so people understand that we're not just talking about acute pain here. Chronic pain is devastating, and for the kinds of things that you're talking about, pharmacists are not getting proper training in that. I don't think anyone is getting enough training in pain.
So it's pharmacists who aren't getting the training, but you've also said that the physicians don't get enough.
Correct.
Dr. Koop?
I was just going to say that folks do view guidances as being like gospel. Mm-hmm. So I think those guidances on the quotas, I think they've been taken too far, and that needs to be rolled back. It's one thing that can be done. Yes, all healthcare professionals could certainly benefit from more education in this area.